So I think we'll get started. Again, I'm Beth O'Hara-McClavick. I'm with Maine Community Health Options. I do outreach and education here in York and Cumberland counties. And Maine Community Health Options is, I say brand new, but we have been now having members this past year in 2014. But we are a fairly new health insurance co-op, a consumer operated and oriented plan. It's a model of a health insurance company that was started under the Affordable Care Act. And we are very, very proud to be here today. We're proud that of the folks who came onto the marketplace last year and got health insurance, there were 2 insurers last year, 83% of them came to Maine Community Health Options. So we had a wonderful year. We're starting in for 2015. In addition to being in every county in Maine, we will also be in every county in New Hampshire in 2015. So we're down there doing the same things, reaching out to the public with information about health insurance, and also enrolling people for qualified health plans in 2015, and we'll talk a lot about today about what all of that means. Before we do anything further, I do want to thank the folks here at York Library, Robert Waldman and Kim and Myers, and also the people from York Hospital and the Women's Committee specifically from York Hospital, the folks from Friend-Raising, Jody Merrill and her team. And I also want to introduce you to Brianna Harris and to G. Johnson. And they are certified application counselors right here in your backyard. Wonderful people who have been certified. To be a certified application counselor means you have to do training through the federal marketplace to help people get enrolled for health insurance. So I'm going to give you the number, and that is at Friend-Raising at York Hospital. It's 207-351-2385. They will be, the Friend-Raising office will schedule time with these folks if the people need to enroll for a marketplace plan, a qualified health plan under the marketplace. Very briefly, I want to talk about the Affordable Care Act achievements to date. So some of these may be very familiar to you. Young people are now able to stay on their parents' plans until age 26. I have actually plenty of children in that category who have been able to stay on our plan. The 80-20 rule for insurance company overhead, has anyone heard about the medical loss ratio? So that is, if you've heard about people getting checks back from their insurer in July, the last couple of years President Obama has mentioned people getting rebate checks. That is because people have not held to the medical loss ratio, and insurers under this 80-20 rule, for every dollar we as insurers take in premiums, we need to be paying out 80% of that in claims. And it's basically keeping insurers to a higher level of what they're paying out and to less overhead. No denial of pre-existing conditions. That was true for all of us beginning last January 2014. Before that, it was true earlier due to the Affordable Care Act for children. But now if people have a pre-existing condition, you cannot be refused insurance. You cannot be also charged additional for insurance under these qualified health plans. No lifetime or yearly maximum caps on coverage. These last two we'll talk about in a little more depth and detail, the 10 essential health benefits and preventive care, and the advanced premium tax credits or the subsidy. Okay, so we'll talk more about those. So the 10 essential health benefit categories, the idea behind this was for years people had insurance that didn't really truly feel much like insurance, didn't feel very comprehensive, didn't feel like it covered a whole lot. So these 10 essential health benefit categories have to be included in all qualified health plans that are on the health insurance marketplace. Ambulatory services, back and forth to the doctor, outpatient care, emergency service hospitalizations, maternity and newborn, so right in there. Mental health and substance abuse treatment under the Affordable Care Act. Mental health received much greater parity in terms of mental health and medical health receiving greater parity. Prescription drugs, rehabilitative, laboratory services, pediatric dental and vision. Our plans in 2014 did not include pediatric dental. We do have the option in 2015. We have partnered with Northeast Delta Dental. So some of our plans you can choose to take it with or without the pediatric dental, but Northeast Delta Dental is also on the marketplace with standalone plans. And then chronic disease management must be covered in these plans, okay? But there's also, in addition to that comprehensive nature, under the Affordable Care Act, preventive care at no cost is available with qualified health plans. So pap smears, mammograms, GYN checks at a certain age, prostate screening at a certain age, colonoscopies, immunization, so your flu shots, zero cost, shingle shots at a certain age. If you go onto healthcare.gov and people think that's where you go to enroll, but you can also go to learn a lot. And if you put into the little search engine box on the top right, preventive services, it will actually give you a 9-page list of things that are preventive services under the Affordable Care Act. The first section is for all of us, the second section is for women, and the third section is for children. Definitely worth looking at. People will say, do I really want to get a health plan this year? Do I really want to incur the penalty? What are my choices? And one of the things we try to remind people is by getting a qualified health plan, yes, you're paying your premiums, but you're also getting preventive services at no cost. So it's something else to consider, okay? And understanding the qualified health plans, again, both on and off the marketplace. Catastrophic plans are the lowest monthly premium, it's highest allowable deductible. So these catastrophic plans are really only available if somebody is under 30 or if they get what's called a hardship exemption through the marketplace, okay? For most people, they're gonna be looking at the bronze, silver, and gold plans. And what I think of, these are actually that 60%, 70%, 80% of the cost paid by the insurance company. Think of this in two ways. One is, it is actuarial value, but I think of it as levels of generosity of the plan. Okay, so 60% of the costs are paid by the insurance company on a bronze plan. That is for a pool of people, a population of people. It's not first dollar, I go to the doctor and my insurance company pays 60%. It's that the way the plan is built is for a full population of people. About 60% of costs will be paid by the insurer in a bronze plan, about 70% of costs paid by the insurer in a silver plan, and 80% paid by the insurer with a gold plan. Now, what you want to think about is, obviously, if the costs are going, in terms of what the insurer is paying, is going up as you move across, the premiums are going up as well. And you're going to pay more in premiums for a gold plan than you will for a bronze or a silver. But it's a way also to compare not only, for example, our 3 silver plans to each other, but it's a way to compare our 3 silver plans with the other insurers who are on the marketplace. And this year, it will, for 2015, when I say this year, it will be Anthem, Harvard, Pilgrim, and Maine Community Health Options. And Delta Dental, again, will be on there with standalone plans, and we have some pediatric dental that we're partnering with them on. But that's how you do some comparisons in terms of these plans. And I'll show you when we get to, and we have handouts here of all of our plans in your package of materials from us. In the back, you'll see it will be breaking out by our catastrophic plan. Our bronze plans are in the dark green. The blue is all our silver plans, and then the Community Advantage Gold. And on the right side of that page is sort of deductibles and some of the information. It's the very inside of the back cover. The general rule, again, is as you move up, the premiums are going to get higher as you move from bronze to silver to gold, but the out-of-pocket, so your co-pays, your deductibles, your out-of-pocket maximum, and your co-insurance percentage will come down as you move across that grid. And then in terms of what you pay, the terminology is really getting more and more complex. We're learning more about health insurance maybe than we ever wanted to know. Premiums are what you're going to pay every month to the health insurance company, okay? So you want to take into account when you choose a plan all of these things. You're balancing them. And your premiums are going to be based on geography, family size, age, and tobacco use for most plans. We do not surcharge for tobacco, and we'll get into that. But the premium that's set based on those conditions can be offset based on income, and that's when we get into the subsidies. But typically, has anybody been on our site, Maine Community Health Options, and run a quote for themselves or for someone else? Okay, so somebody has. The information that you're asked on our site when you get a quote is very minimal. It's what's your zip code, what's your date of birth, if there are additional family members, what their date of birth is. So that's family size is being considered, and also the age of each person that's being insured. And then you go to the next page, income is in there so that people will know if they're eligible for reductions in the premiums in terms of premium tax credits. And then we don't surcharge for tobacco at all. And we made that decision because we want people to come on board and we want people to be able to take advantage of our tobacco cessation programs. So that's just a philosophical decision. We didn't want people having to say, no, I really don't smoke when I really do, and I really should think about the tobacco cessation. Okay? Copays are the flat amount that you're going to pay perhaps when you go to see your primary care provider, when you go to see a specialist. Some of our plans have copays for different services, and some of them you have to pay your deductible, and then it goes to coinsurance. So the copay is typically, maybe it's that $25, $50, $75 or more that you're paying when you see a provider, and it may be that your prescriptions, generic prescriptions, typically carry a copay. Some of the higher level prescriptions might require you to hit your deductible before you actually get help from the insurer in terms of coinsurance. And then the deductible is the amount that if it's not a copay service, but it's a covered service, you're going to have to hit, and I'm going to hit this microphone all day here. I talk with my hands. So you're going to have to reach that deductible before you get into coinsurance. So if I am going to the doctor for labs, I'm going to be paying the cost for those labs until I hit my deductible. And then between the deductible and the out-of-pocket maximum, the most I would have to pay for covered services under my plan, that's where coinsurance comes in, and the percentage of coinsurance that you're charged versus what the coinsurance that the plan is paying. So for people, there is a lot of sort of deeper understanding. That's obviously a very brief coverage of that. And what we do have on our website is a glossary of terms, and I can get some of those too to York Hospital if anybody's interested, or if anybody wants to tell me today, I can get there's a full glossary on our website. And it really walks through not only those terms, but covered services. Covered services is everything that's covered under your plan. So for example, an example of something not covered under an MCHO plan would be cosmetic services, right? So when we talk about out-of-pocket maximum, we're talking about staying in network. There's a separate deductible and out-of-pocket maximum. If you go outside of our network, we have every hospital in our network, so people typically stay in network, and we have a very broad list of providers. But you do want to pay attention to these things so that you understand when you're selecting a plan what works best for you. And that's where people like G and Brianna, who are able to help people walk through this process, people can call us directly at Maine Community Health Options. You'll see all over your materials the 855-624-6463 number, and that is our member services team. They can answer a lot of your questions. I am a licensed producer with Maine Community Health Options, so when people get into the nitty-gritty of which one is really best for me, this is how I've used insurance, these are the prescriptions that I take, we can assist you with all of that. So your out-of-pocket maximum, it's separate from your premiums. Your premiums you're paying every month to your insurance company. Your out-of-pocket maximum, and there's an individual and a family, is the most you're going to have to pay for covered services in a given year, okay? So as long as it's something that we cover, again, we don't cover cosmetic surgery, as long as it's something we cover, that's the most you'd have to pay. So if you had a hospitalization that was quite expensive, you may be paying the first piece of that with your deductible. When you're between your deductible and your out-of-pocket maximum, you're paying the percentage, the coinsurance percentage, until you've hit that point where you've paid your out-of-pocket maximum, and then you're done paying for the year. Again, assuming you're staying in network and that it's a covered service.
So is the premium and copay included to out-of-pocket?
The premiums are completely separate, and they are not included to out-of-pocket maximum, and that's a great question. The copays are included. So when you're thinking about your out-of-pocket maximum, the copays that you pay are going into that bucket, as are the deductible amounts that you've paid along the way. Okay? We also, with Maine Community Health Options, we want people to get the right care at the right time where they need to. So if somebody is with us, say you're with us in October, November, December, you have some expensive need comes up, you need a surgery. And there might be a point where you say, should I really do it now because I haven't hit my deductible and my out-of-pocket maximum and it's going to be really expensive, should I wait till January? We really don't want people to do that. We want you to get the care when you need to get the care. So we've taken the last 3 months, and your deductible will throw into the next year. So whatever you pay toward your deductible, and it has to be for services encountered in October, November, December, will get carried over, and that will start you off. Your deductible will already be that far along in the next year.
Is there a separate deductible for medications versus regular care?
That's a great question. So there may be insurers, and I don't talk about other insurers' plans, but there may be insurers or other plans that you see where you have a separate deductible for pharmacy and a separate, or medications, and a separate deductible for medical health services. Ours is all one deductible, okay? So then that's a great thing to look for. So the marketplace, or the exchange, or the marketplace, that's this next slide. It's basically, it's a website, healthcare.gov, and it's an online portal. It's also got a call center attached to it, and it's basically a marketplace, an online marketplace for people to get health insurance. So healthcare.gov is this single online portal, and the idea is there would be this single door to coverage, okay? People would fill out an application, and people have compared the beginning. Anybody use TurboTax, where the way in which you answer the last question determines your next question? So if you go online with this, they'll ask you, Social Security and income information, and do you have health insurance, and do you have employer-sponsored insurance, and all of those things. And as you go through, if you say there are 5 people that are going to be covered under my plan, they're going to go back and ask you all that information for all 5. At the end of their questions, you're going to get what's called an eligibility summary, okay? So it may tell you that you are eligible for Medicaid for Maine Care in Maine, and people are finding out for the first time they didn't know they were eligible to get Maine Care here in Maine, that their children are eligible for CHIP, which is the Children's Health Insurance Program, that they are eligible for premium tax credits. These premium, you'll hear the word subsidies, you'll hear tax credits, and these are discounts on the premium that you need to pay each month. Reconcile at the end of the year on your taxes. And then if they're not eligible for any of those things, they will give them the opportunities to get unsubsidized coverage, okay? And the idea is the unsubsidized coverage, our plans for people who are not getting tax credits on the marketplace are the exact same plans if someone called and enrolled directly with us. The difference is if I'm talking to somebody who's not going to be eligible for tax credits, and we'll cover who is in the next slides, they might come to us directly because there is truly not a benefit of going through the marketplace. But if they're going to be eligible for premium tax credits, cost sharing reductions as they use their health plan because of their income, they'll definitely want to go through the marketplace, okay? At the end, once somebody has the eligibility summary, which tells them what their potential eligibility and discount on their premiums might be if they're eligible, they're going to go to something that feels more like Travelocity. You're going to see all the insurers for Maine. They'll ask you, the first question they'll ask you is, what state are you applying for? And you're going to see everything in Maine available to you, okay? So you're going to see the 3 insurers, and you're going to see all of the plans available. Now, if I'm not under 30, which I'm not, and if I don't have a hardship exemption, it's not going to show me the catastrophic plans because I'm not eligible, okay? But as I go through this, I can look at the plans, and they'll actually come up from the least expensive to the most expensive for me. But one of the things I want to look at is, in addition to looking at the cost, that's the premium cost, if I'm eligible for cost sharing and some of these things, you want to look very closely, and I'll show you the places in which you want to make some decision points, okay? Not until you select a plan, at that point they'll say, would you like a standalone dental plan? Okay, so Delta Dental is a decision that you make after the medical plans, and look at the plans. Some of the medical plans, again, will include pediatric dental or other things. Then you want to get all the way through, and not until it says congratulations do you know that you're done and you've actually enrolled in the plan. And it's important to know that you've actually hit the end point, because the date at which your application is completed is the date, it affects the date that you can actually effectuate or begin your coverage. Okay? And so again, this is a place where people can do this apples to apples comparison. Now, not everybody has a computer, and not everybody wants to do this online. So this is where your options come in. There's a call center. It's 800, and it's on the last slide, probably the most important slide that I gave you in the packet, is that information about resources. It gives you our website, and we'll get to it at the end, but also that healthcare.gov has a call center. It's 800-318-2596. They're 24/7, 365 days a year. The other way is, and a lot of people feel strongly, they want to just sit with somebody and walk through this process. And that's why I introduced G and Brianna, and then Candace Milliard also works over at your hospital doing this work. And those are the people who have been through the training on the marketplace, on the federal website, who really know how to help people walk through this process. Okay? The advanced premium tax credit, you'll hear it referred to as the subsidy. It is a way in which, if you're going to require that everyone has, the individual mandate requires everyone to have health insurance, okay? For 2014, the penalty was $95 a year or 1% of income for people who didn't have, and that's an individual. You'd add half of that, $47.50 for each child in the family, $95 a month for each adult, up to a $285 bucket or 1% of income. So there was, and it's the greater of those two. So people keep thinking, oh, it's only $95. Well, next year for 2015, the penalty goes to $325 for the individual, okay? And it goes up to a family maximum of $975, so 3 times, or 2% of income. And it goes up again for 2016. So the idea is that people need to get insured, but if you're going to require them to get health insurance, then you need to help people get there. So the system that they have put in place are these advanced premium tax credits, a reduction in premium based on income and based on what you expect somebody to be able to contribute, okay? So the way that they figure this, and you won't have to do it, it's just the way that they figure it, you can conceptualize it. You have the premium tax credit. It's going to equal what it would cost in Maine to get the benchmark or the reference plan. It's the second lowest cost silver plan, minus what your expected family contribution is. And that's your premium tax credit. That's the amount every month that you have to put toward the plan that you choose, okay? You can only use these premium tax credits. You can't use them on catastrophic plans. So sometimes it works out more favorably financially for someone to not pick a catastrophic plan even if they're eligible. But you can use it toward the bronze, silver, gold plans. Now, the percent of income that they're going to expect someone to contribute, if they're at 100% of the federal poverty level, it would be 2%. And if they're at 400% of the poverty level, it would be 9.5%, and it graduates. So for a family of 4 here in Maine, if I have a family of 4 and the family income is between $23,850 and $95,400, then I can expect that there would be some level of premium tax credits that I can get. That's a lot of folks here in Maine. And Maine actually, we were the first per capita in the country in terms of enrollments on the marketplace. 44,200 plus people enrolled in the marketplace last year during open enrollment. About 90%, somewhere between 90 and 95% of people had some level of premium tax credits, okay? So very important that people find out what it is that they are able to get for these premium tax credits. To go back, in order to get premium tax credits, you have to meet certain conditions, okay? One is that you're between 100 and 400% of the federal poverty level, okay? And this is graduated obviously by household size. The other is that you're not eligible for other government or employer-sponsored coverage. So if I'm 68 and I'm eligible for Medicare, I'm all set. I can't get the premium tax credits. This is meant for people who don't have employer-sponsored coverage. If I have employer-sponsored coverage and it's affordable and it's credible. Credible means it's at least a 60% level actuarial value that we talked about, at least a bronze level plan in terms of what it covers. Excuse me. And affordable means that if for my individual plan with my employer offers me insurance, what I have to pay in premiums is less than 9.5% of my household income. Okay? That's considered affordable, and I can choose to walk away from my employer plan and go onto the marketplace, but I'm not going to get premium tax credits. Okay? And just back to your point earlier about who's eligible and who's not eligible. So we mentioned if somebody's eligible for Maine Care, if they're eligible for Medicare, or if they have employer-sponsored coverage, they're not going to be able to get the premium tax credits, okay? But in addition, there are 2 kind of gaps, and we tell people about this. You'll see that it starts at 100%. So there are people, because Maine did not expand Maine Care, that are under 100% of the federal poverty level, but they're not a categorical group supported by the Maine Care system. So if they don't have a disability, if they don't have a child in the family, if they're not parents with children in the family, if they're not a pregnant woman, there are a number of categories where people who might be earning less than 100% of the federal poverty level, but they are not eligible for Maine Care the way it is currently, okay? And that's why there is so much discussion about these people being left out. So if I earn 105% of the federal poverty level, I can get very deep discounts on my premiums under the Affordable Care Act on the marketplace. If I earn 80% of the federal poverty level, I'm not going to have the opportunity. I'd have to pay full freight for these insurance. Very, very difficult circumstance. We talk to people all the time who are in this gap. The other gap is, and this was a glitch written as they were writing the law, is if I'm offered by my employer insurance for myself, and it's very affordable, but by the time I add my family, it's no longer affordable. The family's not eligible for premium tax credits as long as the employer is offering, and it's a problem. It was a typo written to the law. They didn't fix it, and they're not going to reopen it at this point. So it's something that hopefully over time will get addressed, but again, a difficult thing when you're with people who are caught in that glitch. This is just a similar view, but if I am between, if I'm a family of one, if I'm an individual, and I'm between 11,670 and 46,680, I'm going to be eligible for some level of premium tax credits. Again, if I don't have, Medicare, Maine Care, or government-sponsored insurance, employer-sponsored insurance. This second line is about cost-sharing reductions. So we said at the beginning, there's one level of assistance which is around premiums, but there's another way in which they're trying to make sure that people can afford to actually use their health care insurance. So lower premiums, lower out-of-pocket costs for people who are between 100 and 250% of the federal poverty level. So if my earnings as an individual are between 11,670 and 29,175, I can be eligible for different levels of cost sharing, which will reduce my copay, my deductible, my coinsurance percentage, and my out-of-pocket maximum. And then just some things about Maine Community Health Options and who we are and how we kind of arrived on the landscape in the last couple of years. So I started in Maine Community Health Options about 20 months ago, and I was employee 19. We're now over 100. Again, we did not expect to get 83% of the market last year, so we have been growing rapidly to accommodate that. We are a nonprofit under the laws of co-ops, consumer operated and oriented plans, as it was written into the Affordable Care Act. We must always remain a nonprofit. So people will say other people came into the state as a nonprofit. Didn't stay that way. But we will always be a nonprofit. We emphasize that we are member-led, member-governed. So again, written into the bylaws are that we didn't have members until January of 2014. Now that we have members, last month we did our election for the board of directors, and under the laws, we must have more than 50% of our board be member subscribers of the plan. So it's helpful from our perspective to know what people really want and how they're living the plan, because those people are going to be guiding us going forward. So they were announced at our annual meeting last month, and we will be having a lot of obviously input from people who are living our plan. We've been based in Lewiston, Maine since the beginning. We now opened a very small effort in Concord, New Hampshire that is working and building out our network and building out. We also have, in addition to every hospital in Maine, we are working and finalizing contracts with every hospital in New Hampshire. So again, the objective is to allow people to get the care that they need close to home with the providers they know and trust. And I can show you how to check to make sure your provider is with us on our website as well. And then we do have this national WRAP network, this First Health network that I had referenced with you. If you have, a child who's out of state in college, if you are lucky enough to be out of here in the winter for a few months, if people need to be seen, you may have a child out of state who needs to be seen by a dermatologist, and they can pick a dermatologist within our First Health network and go to that person, and you're still in network. Okay? If it's emergency, you go to the closest emergency room. But in that case, other than that, we do ask that people, in order to get in network rates, if they're out of state, they need to go to our First Health network, and I can show you how to do that. Our chronic illness support program, it's something that is covered in great detail in this book. It's I think page 5 or 6, it's partway through. But what we have done is really offered additional help for members with certain medical conditions. So these are the conditions covered: asthma, chronic obstructive pulmonary disease, coronary artery disease, diabetes, and hypertension. And for those conditions, we are making sure that people can get the care that they need. So we reduce out-of-pocket costs, copay, deductible, and coinsurance for disease management services, office visits, prescription medications, and certain lab services. It's not every lab that your doctor orders, but if it's, for example, if I'm a diabetic and it's the routine management of my diabetes, then that service gets reduced. And we'll show you what this looks like. And I know this is a bit of an eye test. I have up here a handout that includes all of the conditions if this applies to you or someone you know, but generic prescriptions are going to go to zero. All these things on the left go to zero cost sharing for routine management of diabetes. So office visits to your primary care provider, endocrinology consult, podiatry consult, diabetic eye exam, lab services for the routine management. Those are all going to zero. We do point out that if it's something like Humalog, which is a tier 3 prescription with us, it's going to be covered regular deductible and coinsurance, but only the tier 1 and tier 2 prescriptions are affected by the chronic illness support program. So this is just, again, this is down into the weeds a little bit, but we do like to tell people we're trying to give people who have these chronic conditions the opportunity to get care, to not split their medications and take half, to not go for that consult. And then one of the things that we have focused on is really integrating behavioral health and medical health. So the Affordable Care Act put into parity the same copay for primary care services and for behavioral health services. We've gone beyond that, and except for our community safe harbor plan and our community options, our HSA plan, all of the plans that include the chronic illness support program also have the first 3 outpatient behavioral health visits at no cost. The idea behind this is that sometimes people recognize they need to have a visit with a behavioral health specialist. They need to follow up with that, but that we didn't want the finances to be a barrier. So we have put forward that those first 3 outpatient behavioral health visits are at no cost, and also the ability for people to have behavioral health visits the same day as the medical visit. So if they go for a medical appointment with their PCP and it's really determined they need to see somebody that day, we'll make sure that we don't provide any administrative roadblocks, that we facilitate that there's a warm handoff, and we will pay both the medical visit and the behavioral health visit in the same day. I will tell you, when we are out talking to social worker groups, they're very, very happy about this, that we are providing this service and that we're encouraging people to get the care, again, that they need. And then the tobacco cessation, I mentioned briefly, we don't surcharge. We don't use that tobacco rating band, so people aren't paying higher premiums if they're tobacco users. Any FDA-approved tobacco cessation medications, including prescription and over-the-counter, have no out-of-pocket costs when prescribed by your healthcare provider, okay? And again, generic nicotine replacement therapy, gum, patch, lozenge, Chantix, we do provide up to two 90-day treatment regimens, because we know people sometimes, toward the beginning of the year, they may try and it doesn't really take, and they need later on in the year to try again with the Chantix. So that's something that we support. And then the enrollment and re-enrollment details, and the CACs will be able to attest to the fact that this is a busy season. So open enrollment began November 15th. It continues on until February 15th. And we'll go through when you have to be enrolled by when. The first date is December 15th. At December 15th, anybody who's enrolled through December 15th can get coverage beginning January 1, and then it slides out from there. But it is a very important time, because for most of us, we do have to enroll during open enrollment. There are people who enroll outside of this 3-month period with a special enrollment, but that would require that you have lost coverage because you lost your job, you lost coverage because you turned 26. Maybe if you have a baby or you adopt, you can add the baby at that time. If income changes such that different things become available, so your income has changed such that all of a sudden now you perhaps through a loss of job or minimal, getting less hours at work, you're now available to get a different type of plan. That is something that is sometimes opening up a special enrollment. For most of us, we're going to need to enroll by February 15th, okay? So the way that this works, and I think if I can illustrate, I'm going to come out of my PowerPoint here for a moment. And somebody mentioned they'd been on our website. This is our website. A lot of information on here. In fact, I think a lot of events. If you want to point people to events that we're doing, there's the event that we're doing right now at York Library with York Hospital. And three things I want to show you are how we compare and quote plans, just how you'd find your healthcare provider, and then the formulary so people know where to find these things, okay? Compare and quote plans. Yeah. I've got to, this isn't my laptop, sorry. So this is the opportunity. You don't have to put any identifying information other than your zip code, your birth date, and your income. No one's tracking who has gotten on here. But you can get a quote, and you saw the box next to it is also to re-enroll. I don't know if anybody is also looking to re-enroll, but I can talk to people afterward, or if you have questions about that. These first two boxes are for people who are already our members. So if you're a member of MCHO, you can do a lot of self-service. You can come here, you set up your portal. These are for the people who have already set it up. Find out what your deductible, how far into it you are, what your explanation of benefits for different services. You can review a lot of material. If this box is for people who are members of ours, but they've never really gone onto the computer to set up their own portal, they may just call member services, which is totally fine. And this is for people who want to shop for plans for the first time. And so, anybody know the zip code here? I don't know it. 03910. 03910. And this is how simple it is. Right now, because we're before the 15th of the month, if I signed up all the way today, my coverage would begin January 1. Now again, I'm taking you on our website. If you end up being eligible for premium tax credits, you must go through the marketplace ultimately. And there's a way to go from our website to do that, or you can start off at healthcare.gov. I'll put in here my birth date. And okay, so this is a little bit different, this computer, sorry. And I'm gonna just put myself in as a single person in order to move this along quickly. And I'm gonna put a salary of $22,000. This is your best estimate for next year, for 2015. And I wanna show this so that it will actually show premium tax credits and the cost sharing reductions, okay, and how you'd look at that. And I'm gonna say I'm a household of one. I'm saying that I have no affordable employer coverage available to me, that I'm not a member of a federally recognized Indian tribe or Alaska Native tribal entity. And the reason for that question is they have different rules and different cost sharing for those who are members of those tribes or Alaska Native tribal groups. That I have no certificate of exemption. This is going to obviously not bring up a catastrophic plan for me because I'm not age appropriate, and I just said I don't have an exemption. So it's telling me, and this is again all on our site, it's giving you what's called your profile here, your eligibility summary. We are typically within about $5 of what the marketplace will tell you, so you're getting a really good estimate. Sometimes we're closer than that. And when the marketplace was having its trouble last October, this was working, so people were coming to us to get a good sense of what they could expect. It's telling me that at $22,000, I'm 189% of the federal poverty level. So that's telling me, since I don't have employer-sponsored insurance that I've told it, I'm going to be in the range for premium tax credits, but I'm also going to be in the range for cost sharing reductions. If I don't get insurance next year for 2015, that's the penalty estimate, is the $325, but it's telling me that I have premium tax credits. The estimate is $343.70 for what I'd have to spend each month on the marketplace. Now, I can go and begin a marketplace application here, or I can look at plans. And you can always go to the marketplace directly through healthcare.gov, or there's a place at which if you select a plan here, it will tell you, go to the marketplace to make sure that you're eligible for the premium tax credits. So Community Option is one of our chronic illness support program plans for $40 a month. Those are some of the key numbers. Because I've put in information that said that my salary was $22,000, I'm going to be eligible for these reduced cost sharing plans. And you see where it says cost sharing reductions? I'm going to just show you over here, okay? You must select a silver plan if you're eligible for cost sharing. So what I'm going to do is I can compare a couple of them, and this is all stuff I can do on my website without sharing any personal information, okay? And I'm just going to show you. The plus plans have pediatric dental. When I said we had pediatric dental embedded, so since there's nobody in my family, I'm saying here that it would be eligible for the pediatric dental. I'm going to skip those. and it allows me to compare up to 4 plans. So I can do this once, I can compare 4, I can do another comparison. I can email it to myself, I can print it out as a PDF. And what this allows me to do is to look at the comparison. So these for me at my age, at this zip code, if I lived here and made $22,000, that would be my plan cost per month for the silver plans. The reason I took you to the silver plans is you'll see the deductible has gone way down because I'm eligible for, if you see silver 73, 87, or 94, it means you're eligible for the cost sharing. So it brings you, the deductible now has gone down to $500, a lot less than what you see in your packet of materials, which was what the packet of materials you have is the base plan. And my out-of-pocket maximum has gone down to $1,250. I'm sorry, to $1,750. The difference is $1,250 after the deductible. So you can see that these $5 copay for generic prescriptions, $10 copay for primary care visits, the costs have gone down because of that. It also happens that people will say, by the time I'm looking at it at a cost-sharing plan, your 3 silver plans look awfully similar, and they are. So typically, Community Value, which is the least expensive of our silver plans, is the one that it is by far our most popular plan. Typically, for people who are eligible for cost sharing, they're looking for the premiums to be lowest, and the plans are almost identical. One of the places that you'll see the difference is in preferred prescriptions here. You'd have a copay as opposed to have to going all the way to your deductible first. And typically the Community Value is where people end up if they're eligible for cost sharing. Okay? So I know that's brief. If I said I wanted the Community Value, you can see it says select only on the marketplace. It says, thanks for choosing us. Here's my data. Here's my brief profile. I'm in York County. That's my birth date. I'm getting effective coverage because I have to be in by 12/15 to get 1/1 coverage. And there's the estimated premium tax credit, but it says to please go on to the marketplace, okay? So sorry, this mouse is a little different. And so I would go over and confirm with the marketplace and do my application on the marketplace as well, okay? 2 other quick things, because I know we have about 10 minutes and I want to leave a little time for questions, but 2 other very quick things. If I go back to our homepage, find a healthcare provider. So I can put in a hospital or facility, and I can put in York. Never did that before, hopefully. Yep, York Hospital, and these are some of the other facilities in York, okay? I can put in a provider. I tell people put in less rather than more, just put in the last name of the doc and whether they're a primary care or specialist, and that's the easiest way to find that. But I also want to just show you here how to find a provider outside of Maine. And I typically just show people, because I grew up down there, if I look at Massachusetts and I go to Boston, these are facilities available to you here, or if you have, again, somebody who's out of state for part of the year, or you want to go down and utilize these facilities. And there are 9,000 results in Boston. If I look at the hospital list, it's a very impressive list of hospitals that are also part of in-network with Maine Community Health Options through our First Health. So Beth Israel, Boston Medical Center, Brigham and Women's, and those types of organizations. So I can help people with that if they're interested in seeing more about that. And the last thing I'll just show you, and it's at the bottom of every page, is our formulary. So the drug formulary is where you want to look and see what level prescription your prescription is carried. Is it a generic? Is it a tier 1, tier 2, or tier 3? And this is a 100+ page document, so you're not going to want to flip through it. You can do a control find. It's just taking a while to load. Or you can call our member services team. They'll walk you through exactly. Oh, this isn't. There we go. And so it has the codes up front. But for any prescription, if you just do a control find, it will tell you. And if anybody has interest afterward, I can check that for you. Okay? But it is pretty straightforward. It'll tell you whether it's a specialty drug, whether it's covered on our chronic illness support program. If it says CISP1, it means that you can actually, if you have that chronic illness, the diabetes or the hypertension, you'll have that generic prescription for 0 cost. So I'm just going to briefly go back to our slideshow here. So people shopping for the first time, open enrollment started November 15th. It closes February 15th. We keep harping, sorry, on those dates. December 15th is the last day to be enrolled to get a plan for January 1. From the second half of the month and then the first half of the following month in order to get February 1. So December 16th to January 15th, the plans, any enrollments that happen at that time would effectuate or begin on, the plan would begin February 1, and then January 16th to February 15th will begin for March 1. Re-enrollment, people who already bought plans through the marketplace in 2014 will be automatically enrolled for 2015, and the coverage will start. So if people were enrolled with us, the marketplace had 8 million people enrolled. They didn't want a chance that everybody remembered to go and do it. They re-enrolled everyone. If people, obviously, if they don't pay their premiums, they're not going to stay on the plan. But the important thing to remember are there people who are going to be in the re-enrollment process? Okay, so you want to make sure that you check what they have for your premium tax credits, that you update your income information, that you update household size. If I have a child who's no longer a tax dependent, no longer in my tax household, I need to indicate that, because being a smaller household with the same amount of money, I may not be eligible for some of the premium tax credits or some of the things I was previously eligible for. So you want to be active. You want to make sure you always check the box that says, are we allowed to look back at your IRS information for the last couple of years or going forward? In order for them to continue to offer premium tax credits, they have to have the ability to look at those things. People should update, again, the income and the household information. All of our plans for 2014 are the same in 2015, so anybody who enrolled in Community Value last year, they can move right to Community Value. They're 3+ plans. You'll see we had 7 last year. We have 10, and really it's just Community Option, one of the bronze, Community Value, and Community Preferred now offer pediatric dental if you want to choose it. Now the premium will go up, so you want to make sure if you don't have anybody eligible for pediatric dental, you're not accidentally picking a plus plan. If there's nobody in your house under 19, just ignore the plus plans and make sure you don't select that. Okay? Once a member enrolls, we do tell you, please wait 72 hours. We won't have your file from the marketplace, so we don't want to be in a situation where you're calling and saying, can I have my member number, and we can't get that to you. The welcome letter is mailed 5 to 7 business days after we receive notification from the marketplace. It is important that you make that first binding payment before the date of effectuation, because otherwise the plan's terminated. So on the first one, there's no grace period or anything. People enrolling by December 15th must pay by January 1. We will take credit cards only for that first binding payment whenever it happens. I mean, throughout the year, if someone enrolls they've got a special enrollment, they enroll in April. That first binding payment, we always will take a credit card because we know sometimes the window's tight. After that, we don't accept credit cards. We're a nonprofit. We're trying to keep our rates low for our members. From 2014 to 2015, overall, our rates went down 1%, which is pretty cool in the health insurance industry. So we want to make sure that we, are responsive to people in offering that the first month. But after that, you can pay by check, money order, debit, automatic withdrawal for the bank account. A lot of people do that. They set it up. They don't have to think about it. It's coming out every month. And again, the payment is due on or before the first of every month. And then this is just the last slide. Where do you find assistance? You can call us at Maine Community Health Options. You can visit our website. Consumers for Affordable Healthcare is a fabulous organization here in Maine that is available to you. They have a helpline. You can call them, and their whole mission in life is to make sure that people can get insured here in Maine. So if there are people who fall into the gap, I suggest they reach to them. If there are people who want to know more about Maine Care and the Children's Health Insurance Program, they're just a wonderful resource. In order to find somebody near you, I introduced G and Brianna, and Candace isn't here today, but she's also the other sister over at York Hospital. You've got somebody right in your backyard. But for people, if you have friends in other part of the state and they don't know where to get help, they can call us. We'll tell them where to go. We can also send them to enroll207.com. You put in your zip code and they will show you the closest people, agent, broker, who are trained in this, or navigators. The Lobsterman works with the fishing community, the community action programs, the hospitals, the federally qualified health centers. So Nasson Health Center over in Springvale, York County Community Action in Sanford. Across the state, there are a lot of folks doing this work. And then healthcare.gov, again, 800-318-2596. I tell people 24/7, 365. They're always there. We're really committed to this grassroots, the education and the opportunity for people to find out more. But thank you very much for coming. I know it was a rainy morning to come out on, so thank you. Yeah.